Hi, Dr. Simon Agger here. We're going to talk about whiplash injuries. Whiplash injuries are something that are very common in a lot of Western countries. Here we are in America, and we see these routinely every single day in the practice. Some of the things I want to talk about is some of the common misconceptions about whiplash injuries, and some of the ideas, what is a whiplash injury? The big thing that we think about is a car accident. That's probably one of the most common causes, but it can also happen on bicycles. It can actually happen with falls. We see all of those type of injuries. And a lot of people think whiplash injury just occurs to the neck. Because we've got a thin neck, we've got a 10-pound bowling ball on the top, which can accelerate very quickly and stress the spine. But a lot of times what happens, especially in some bicycle and some car accidents, is when the impact hits, everything goes this way very quickly, straining all these structures through here. The head will usually get the worst of it, and then you get the recoil, where we strain connective tissue. So when we look at these things, what happens in a whiplash injury? If we take a car accident case and we're driving along like this, we get rear-ended like that. The first thing that happens is the head will start to travel back very quickly like this. Just translate straight posterior like that, shearing all these joints through here, stretching all these connective tissues. And when we talk about connective tissues, we're talking about the muscles, we're talking about the ligaments, we're talking about the joint capsules, we're talking about the nerves, we're talking about cartilage. Anything that connects the body together, that's connective tissue. These guys get the brunt of all whiplash injuries. So as it comes back like that, when you're driving the car and get rear-ended, it shears these guys through here. The next thing that happens is the bottom part of the neck, the top of the spine, starts to extend a little bit. At the same time, this starts to create a little S shape here. It starts to hyperflex here too. So we get this straining injury at the top here. At the same time, we're getting a lot of compression in the back. And then it comes back and you get the classic whiplash, rolling back like that, compressing all of the joints in the back of the neck, straining all the connective tissues in the front. Then sometimes it impacts the headrest, which is good, because then it stops the head from going back even further. Sometimes the seat back will break and the body will go back into the back seat. But a lot of times, after the initial impact, then we get the recoil. And the recoil goes the other way. We recoil back from the accident this way. And if we're a driver with the shoulder lap harness right through here, the shoulder lap harness will engage. And that will put us into some left rotation this way, and we've got the lap belt here. So what happens there is we further compress these structures on the left side of the neck area, and sometimes in the collarbone area and chest area through here, as the shoulder harness restrains us from hitting the steering wheel or the windscreen. And that can certainly happen with bigger forces, but we're just looking at a straightforward moderate rear-end motor vehicle accident. When we're recoiling through here, this area is stretched again, so it gets injured twice. All these connective tissues, the muscles, the ligaments, the cartilage, the nerves, and the joint ligaments all get stretched again and strained. And then in the back down through here, if the foot's on the brake, the pelvis is a little oblique like that. When it gets sheared from behind it, it's not getting sheared in a nice stable area where the back's nice and stable. The pelvis is flexed because we've got a foot on the brake. So as a result, we get a lot of injuries in the low back and the pelvic area with a car accident. And all this happens in 200 milliseconds. That's 200 of 1. 200 times faster. The brain doesn't even get a message that the body's getting injured. By the time the brain gets the message the body's been injured, it's already been injured. So the muscles can't splint to protect the joints. And as a result, we get a combination of symptoms, pain, stiffness, headache. Why do we get headache in whiplash? Well, the brain is accelerated so quickly back and forth like that. Sometimes it can be because the brain just got shaken up, just like a boxer in a ring, very quickly. So very commonly, patients will experience some grogginess, some fogginess, sometimes some concussive symptoms, which we'll talk about a little bit later. But that's what happens in a whiplash injury. And when we're looking at how do we get treated for that, well, the first thing that happens after you get injured like that, You've got the adrenaline through the roof. You're trying to get the information from the other driver. Hopefully you can get their name, their address, their insurance information. If anybody saw the accident, it's always good to get a witness name through there. And then try and get somewhere where you can get eyes on it. And all different doctors will have some part to help in a whiplash case. The emergency room doctors, they're going to be looking for fractures. They're going to be looking for any surgical situations where they need to get you to an orthopedist. In a lot of cases, in your moderate car accidents, you'll have a lot of what's called soft tissue damage. And by soft tissue, what we mean is the connective tissues. The muscles are torn a little bit. The ligaments are stretched and injured and torn. The cartilage is strained. The nerves are stretched. And sometimes there's tingling and numbness in the hands because the nerves that come from here and up here, they go down and work the hands through here. We can have some grip strength loss. We can have shoulder injuries on the seat belt. And the stiffness will usually come on over the next 2 days following that, up to 48 hours afterwards. So that's when you've really got to start icing through there. So when you're looking at doctors, you know, sometimes you go to the emergency room. They may take x-rays. They'll rule out fractures. They'll give you some pain medications. But then you're kind of left, where do I go? What do I do? And as a chiropractor, we are one of the best professions to get help with whiplash because we focus on the joints, the muscles, and the nerves. We're physicians in the state of Oregon. We can order x-rays and MRIs. And if there's something where we may need surgery, we work with neurosurgeons too. And so it gives us the best opportunity to heal, help you heal from your whiplash injuries. The massage therapy is very important because we want the scar tissue to become flexible and we want to get you functional. And in the studies on whiplash that have been done with chiropractic treatment, both new whiplash injuries and old whiplash injuries, if they've been going on for a year and a half, great success because we work on the individual joints. We use adjustments, exercise, rehabilitation. So you get your physiotherapy, you get stronger, and we know how to get the inflammation down quickly so you can start functioning again. So now you know what a whiplash injury is. Now you know what doctors to see for whiplash injuries. You do not need a referral to go and see a chiropractor for a whiplash injury. A lot of times you'll have personal injury protection. In our state of Oregon, it usually runs about $15,000, which covers most cases. If you need an attorney, we work with several personal injury attorneys that have been around for a long time. I've been doing this for 17 years. There's a lot of attorneys that I work with who have been doing it likewise a long time, lots of experience. If you're in a car accident, give me a call. Or if you're in another state, I'll get you a referral to see someone that I can trust to get you taken care of. Okay? Thanks for listening. We're going to talk some more about some symptoms, common symptoms of whiplash injuries in another video. Thanks for listening. Again, I'm Dr. Simon Egger, and good to meet you.